Emily, and I'm a level 1 nursing student. My clinical instructor has assigned me to observe you today.
Excellent. Feel free to ask any questions that you might have.
Thank you so much. I look forward to learning a lot. So you're taking care of the patient in room 414?
Correct.
Do you have time to give me a report?
Sure. It is Miss Georgia Pye in room 414, age 61, female, allergic to sulfa drugs. Dr. D. Parker, full code. She's a low fall risk, no pressure sore risk. She's been admitted for monitoring because she had chest pain while walking her dog. It radiated to her back and lasted about 15 minutes, but the resting relieved her pain. She has a history of tuberculosis, and she had that at age 22, hysterectomy at age 57. Christian lives alone, deceased husband, and one daughter that lives away. She's alert and oriented ×3, cranial nerves 2 through 12 are intact, full range of motion, with discomfort with full left shoulder movement. Perla. She is on 2 liters of oxygen via nasal cannula. Her lungs are clear bilaterally, breaths even and unlabored. Her heart sounds are S1, S2, no murmur, regular rate and rhythm. She's got midclavicular point tenderness with palpation. Normal sinus rhythm on telemetry monitor. Her troponin test was negative. She has no edema. Her abdomen is soft, non-tender, normal bowel movements, she said every 1 to 2 days. Her bowel sounds are active in all 4 quadrants. She's got a history of GERD. Self-voids, her urine is yellow, straw-colored, clear, no odor. She's not on INOs. Her skin is intact, pale pink, warm and dry. Her vital signs are within normal range. Her blood pressure runs a little high. Her last reading was 142/85. She's on metoprolol, lisinopril, aspirin, atorvastatin, and niacin, Lovenox, and omeprazole, 20 milligrams by mouth at 9 a.m., and that medication is due soon, due now.
Thank you so much for giving me a report. Do you mind if I ask you a couple of questions regarding the medication, then watch you demonstrate giving the medication in the patient's room?
Not a problem at all. What questions do you have?
Why specifically is this client receiving this medication? What action does the medication have on the body?
Well, the client's been diagnosed with GERD, and so it's to treat GERD, and it interferes with the gastric acid secretion by inhibiting the hydrogen potassium adenosine triphosphatase enzyme system, or the proton pump, in gastric parietal cells. So it prevents additional hydrochloroside from forming, so it decreases the acid.
When should you question administering this medication? Does this medication have a therapeutic serum level? Which vital signs must be monitored? What physiological parameters should be monitored when the medication is being administered?
Well, you should question administering this medication if she's got sensitivity to it. It doesn't really have a therapeutic serum level. Its onset is 1 hour, peak 2 hours, and duration is 72 to 96 hours. Vital signs, all vital signs must be monitored in case she's having an allergic reaction to it. Physiological parameters should be monitored. You've got to monitor the labs, monitor CBC, may increase the AST and ALT and bilirubin. You want to monitor her INR and magnesium levels because it can cause hypomagnesemia.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting? What interventions must be taught for taking the medication safely at home?
Well, you want to make sure that the patient's getting the right medication, the right dose at the right time, and interventions taught safely at home. You want to make sure that she's taking it before she eats, she's swallowing it whole, she's not taking it with alcohol or aspirin, ibuprofen, and she's not pregnant if she's taking it.
What are some side effects and potential adverse reactions?
Dizzy, drowsy, fatigue, headache, weak, chest pain, ab pain, acid regurgitation, constipation, diarrhea, flatulence, nausea, vomiting, hypomagnesemia, itching, rash, bone fracture, and allergic reactions.
How will you know if this medication is effective?
Well, it will decrease the signs and symptoms of GERD. You'll have a diminished accumulation of acid in the gastric lumen. Any more questions?
No, thank you so much for answering my questions.
Not a problem. It's important to know your patient and the medication you're administering to keep your patient safe. Okay, so now I am checking the physician's orders, and it says 20 milligrams of omeprazole, and then I'm checking the MAR, and the MAR says 20 milligrams of omeprazole, and then I'm checking the patient's chart, and it says 20 milligrams of omeprazole, so we're all good there. And it's 9 a.m. and she wants it at 9 a.m. and it's administered at 9 a.m. So, omeprazole. Okay, so I got the drug right here, and that's 20 milligrams, and check, check, check. And I check with 3 checks, everything, it looks good. Okay, let's go. Thank you. This cart is quite large. Good morning.
Good morning.
My name is Jacqueline, and I'm your nurse, and that's Emily, student nurse.
Hi.
Hi.
Can I get you to, I'm going to scan your bracelet. Can you state your name and date of birth?
February 12th, and I'm 61, and my name is Georgia Pye.
Okay, that matches here. And do you have any allergies?
I'm allergic to sulfa.
Okay, that also matches here. All right, well, we're here to give you your omeprazole. So you've gotten 20 milligrams by mouth. So, do you have water?
I do.
Okay, I'm going to wash my hands. And do you have any difficulty swallowing?
Nope, I can swallow really fine.
So with this medication, you want to make sure to take it in the morning. You want to take it as prescribed. You definitely want to take it before you eat anything. And you want to notify your prescriber if you have any abdominal pain or any black tarry stools. You don't, do you drink alcohol?
No.
Okay, good, because you don't want to mix alcohol with it. You want to avoid driving until you know how the medication affects you, because it may make you dizzy and drowsy.
Okay.
Okay, so I'm going to just say that you got the medication. Document it here. Say patient tolerated. It can't be the future. So 8:30 maybe. Can't be the future.
8:09.
8:09.
That clock's a little funky sometimes, I've noticed.
Yeah, you're pretty on top of this screen. You're very observant.
Well, you know, I brought my computer to help me, entertain me while I was here in the hospital.
Well, is there anything else I can get you?
No, thank you very much.
Okay, all right.
Good luck in school.
Then need it.
You'll do fine.
I wash my hands again. Okay.
Thank you so much for demonstrating safe medication administration. I just have a couple more questions.
Really? You have a lot of questions for a nursing student.
Yeah. Were there any pertinent pieces of information you reviewed before administering the client their medication?
Yep. I checked their labs. I checked to make sure that she could swallow because it's by mouth. I checked the physician's orders against the MAR, against the patient, to make sure that she's getting the right dose at the right time with the right patient.
Did this information affect your decision to administer the medication?
Yes, it affects my decision to administer the medication. I decided to go ahead because everything matched up and the patient seemed like she could tolerate it.
Did this information affect how you administered the medication?
No, I mean, you can administer it by sprinkling it on top of applesauce if they have trouble swallowing, but she could swallow, so I gave it to her.
Thank you so much for answering all of my questions. I really feel like I understand this so much better.
Sure, not a problem. I'm going to document now. Do you want to watch that?
I'd love to.
Cool.